I guess the first thing we'll address is talking about the new scheduling software. I think that was a huge success, even though there were a few bugs that we need to work out. We anticipated that. So overall, it was really, really great. This morning when I checked, I think we had like 3,200 people schedule themselves. So that would have taken my staff probably a week to schedule that amount of people. So you can see the kind of time saving this will be for staff. So it's really exciting. The Tuesday and Wednesday initial dose clinics for this week are full. And so the scheduling has been cut off for now. What we're doing for future clinics is we've worked with the vendor and we think we have found a way to target only those people that have signed up on our initial waiting list. So what we're doing now is we are building the spreadsheet so that all the information from that Google document will be dumped into another usable spreadsheet in a usable format. And will be cleaned up because it can only have 5 different data points in there. And so we have to assign each one of those an individual ID number, which is what the system requires. So that's a separate process, but it's a fairly easy process, even though it sounds tedious. There's an easy way to do that, I learned. And so once all of that is kind of downloaded into a usable format, the IDs are created, we should be able to send out a one-time use link to invite people to register for closed clinics. So that means we won't put out a link for the general population or anybody else to be able to sign themselves up. It will be only available to those people on our wait list. So obviously we can't target them all at one time because I think there's well over 20,000 people on the list and we don't have access to that much vaccine. And we're a little bit nervous about scheduling clinics so far out that people forget when their appointment is. So we'll probably do that 1 or 2 weeks at a time. We'll take enough of the people that are on the list, dump that into the system, have it send them a one-time use link. That way, once they schedule themselves, that link will not be able to be forwarded to anyone else. And so people can schedule themselves. Another thing that it will eliminate, and we may end up kind of changing how we're using the system anyway to combat this problem, which we didn't anticipate this was going to be an issue when we opened the link up for people to schedule themselves directly. But what we noticed as we did some QC this morning or some quality control this morning and just looking through to see how many people there were, whether they were scheduled, if there were duplicates in there. So we found that there are duplicates. People have signed themselves up more than once. I don't know the reason for that, if they thought that they needed to get multiple appointments. So I don't know. I don't know why they would have done that. Or if they thought that the first time didn't work. And so they tried again, thinking it was, just to be sure. So in order to prevent that, we may go to a wait list format where people sign themselves up to put themselves on a wait list that's in the actual system. Then that way it pulls from that and sends them the one-time use link rather than just giving them carte blanche to every available appointment that's in there. So we're still kind of tweaking it, as with any new software or process that you implement. There's always some troubleshooting that's necessary. So I think those are fairly minor things to work through. Overall, we're really happy with the success of it. Tomorrow will be the first clinic where we will be checking people in using that same system. So the QR codes scanning those, having it bring people up on the computer in order to check them in will all be new as well. So it may create just a little bit of a delay at the check-in line. So we're hoping that that we can work through those things fairly quickly, and there'll be a short learning curve, but hopefully it will not mess with our process too much. The other thing, as we do this kind of one-time use link, if they get too far into the system and they've already been cleared to schedule themselves, and for whatever reason back out and don't actually leave with an appointment, and they get out and go do something else, the link will be used. So they won't have the opportunity to go back in later once they reach the screen that says you have been cleared to schedule yourself an appointment. Here's the dates that you can select from. And if they don't actually go in and reserve the date, that link will be not usable. So that's just something to kind of put on your radar, so that way when you start the process, make sure that you can finish it. It also did that same thing with the self-scheduling. So we have people who are in there multiple times. They got through the forms, for whatever reason, got out, and then went back in. So it shows them multiple times, but then they've only scheduled themselves once. So that throws us off as far as the count, the overall count. So it looks like you've reached your max number that you were set to schedule, but you haven't yet because people got far enough in there where it counted them. So I know that may be a little too much detail for you all, but just to give you an idea of some of the behind the scene things that we are trying to work out bugs for, to figure out how to address those things. The vendor has been really good about taking our feedback, have agreed to try to fix some things on their end as well that will make it more user friendly. We are planning on having the walk-up line Tuesday, Wednesday, and Thursday. Tuesday and Wednesday, we have initial dose clinics. Thursday, we have a second dose Pfizer clinic. And then Friday is the second dose Moderna clinic. I wanted to address we've gotten a lot of emails and voicemails and concerns about people who need a second dose Moderna. So the clinic was originally scheduled for, I think it was February the 18th or 19th, I'm not sure. So that was the week of the snowstorm, and it was canceled. So we also did not receive the Moderna shipment. So once we received that Moderna shipment, we scheduled the next available date for the availability of the convention center, but also the availability of all the staff who works that hub. And so Friday, March the 5th was the first available date that we did not have a clinic scheduled already. So the CDC says that you can have a second dose up to 6 weeks after your initial dose, and you're still considered kind of in that ideal time frame. The Moderna clinic that we've scheduled for March the 5th is actually 1 day past that 6 week period. And so we have a lot of people who are concerned about that. And so on the CDC's website, you can go and look at that information yourself. There is just a lack of data. I think that it's important for people to understand that that doesn't mean that your whole series is now considered ineffective. You have to remember that the CDC recently put out some information that talked about even one dose is considered pretty effective. I think the number was at 85% the last that I looked at it. And your second dose adds that additional layer of protection. Just because you are 1 day off does not mean that you are no longer protected and you have to start your series over. the CDC very clearly states you do not start the series over again because you are beyond that window of when there is data for. There are lots of people in this boat. One of the things about Moderna is because it's less available than the Pfizer, people have had a hard time finding it. And so we rely on the state to send us the vaccine, and we don't have any control over when they send us things. So it's really out of our hands. And even though we would have liked for it to have been within that 6-week window, our medical staff is fairly confident that one day is not going to significantly compromise the efficacy of that second dose booster. So just know that you are not required to start the series over, that the CDC states you should have it as soon as you can beyond that 6-week period, because there are things that happen. We've had a lot of people say, I'm going to be out of town that day, and they can't get it for whatever reason. As soon as you get back, let us know. We may not have Moderna for a while. And the reason we're not doing the walk-up line or the walk-up scheduling line is because any extra doses of the Moderna, we are going to save on hand so that people who are in that boat who could not get there on that date will have that option to later try to get that second dose of Moderna. So we won't be handing out those extra doses of the Moderna. We can keep that in the refrigerator safely for 30 days. The state sent us a survey, and it was sent to all of the vaccine distributors asking who was willing to receive shipments of the Johnson & Johnson. And so we responded to that saying, we're open to receiving any vaccine that you want to give us. So that's really the only thing that we've heard. We've got some calls scheduled this week with the state to talk more specifically about the Johnson & Johnson. So it's fairly new. It hasn't been allocated out in Texas yet, but I imagine that that's what the call will be about.